So if someone was hesitant, I could relate to them because I was too.
I had a number of concerns about the vaccine.
I think I definitely did have some concerns in the beginning, especially like being Black. When I came to college, I learned a lot more about Black history, and I know one study I learned about in particular was the Tuskegee syphilis experiment.
The history of medical manipulation of Black people in particular certainly has questioned the validity and the perceived vaccine safety.
We know that history where time and time again, Black people and the lives of Black people can be dispensable. And I don't see any lives as dispensable. And that's one of the reasons why I believe it's my responsibility to get the vaccine, because I'm saving not only my life potentially, but I'm saving other people's lives as well.
Within my community back home, they don't feel comfortable getting the vaccine. I think it goes back to not having that access to healthcare to begin with.
I learned more about it, and I realized, like, even though there has been wrongs in the past, like, people are trying to do better, and our scientists are trying to help us right now. They're not trying to hurt us.
Through my own research, what I found is that over 75,000 people have received the vaccine, have been involved in trials of the vaccine. That's many more people than have ever been typically included in a clinical trial.
The report from the CDC shared that there was no disproportionate impact on Black people in the trial. The side effects that we're seeing across racial groups, and the vast majority of people didn't have any side effects. So those were some things that were really important to me.
So we have other types of vaccines that use the same exact mechanism as the COVID-19 vaccine, and things that we use every day.
If we care about our community, we're going to get vaccinated, because it's not just about preventing yourself from getting sick, but the people that you care about from getting sick.
We have to do everything we can to protect not only ourselves, but the others around us.
This is just far-reaching as far as the disease, and it's the best thing we have right now. I mean, if we don't do something now, we won't have to worry about the future.
I think that the vaccine was developed really quickly because we had so many people working on it and so many resources devoted to it.
There was a lot of manpower involved in getting this vaccine into production, and so I don't think it was rushed, to be completely honest with you.
I would encourage other people within my community to get vaccinated because it's very safe. I trust the science and I trust the process in which it takes, and I believe that our technology has improved.
I just really want to get the vaccine because I think this is how we get back to life as it was before.
I've been working with a lot of people at the local public health department who are firm believers that this is the only way that we're going to get back to some type of normalcy in the United States and around the globe.
If I had to just plainly speak, consider getting the vaccine. Yes, do your research. Yes, it's okay to have questions. Yes, it's okay to be scared.
We are not only as strong as our weakest person, but we are also stronger together.